Okay, so the disease that we're going to be talking about is hepatitis C, and we're going to be talking about the epidemiology of it, the symptoms, and the tests and treatments. So according to the CDC, they estimate that approximately 3 to 4 million people in the U.S. are currently infected with hepatitis C virus. There are, however, a few geographic regions where infection is especially common. In Egypt, for example, hepatitis infection occurs in 10% to 30% of the general population. Likewise, the prevalence of infection is greater than 10% in certain parts of Asia, and high rates of infection have been found in certain geographic regions such as Japan, Taiwan, and Italy. In some areas, hepatitis infection is generally more prevalent among persons over the age of 40, but really uncommon under the age of 20. This suggests things like traditional folk remedies or the reuse of needles for injection were probable causes of transmission.
Okay, so I'm going to be covering the symptoms today and the effects that hepatitis C has on the body. So the main organ that it affects is the liver. So it attacks the hepatocytes in the liver. It can result in liver damage, failure, and even cancer. The virus also affects the digestive system. When the liver decreases in bile production, it can affect the digestion of fatty foods, therefore making it uncomfortable to digest these fatty foods. Ascites can also occur because of the lack of albumin that controls the fluid in the cells. Common symptoms include nausea, vomiting, loss of appetite, and weight loss. Hepatitis C can also affect the central nervous system due to the liver not filtering out the toxins, so the toxins go to the brain, which can result in confusion, personality changes, and disorientation. The liver also produces protein for healthy blood, aiding in the circulation of blood throughout the body, and this can result in a poor blood flow that can result in hypertension for the individual that is infected. It can also greatly affect the integumentary system with numerous symptoms that vary upon individual, including rashes, itching, loss of pigmentation, and bruising. In late stages, bilirubin can build up and can cause jaundice, and it can also take an effect on the endocrine system in extreme cases that can attack healthy thyroid tissue, resulting in hyperthyroidism or hypothyroidism.
There are several tests a doctor can perform to see if someone has been infected with the hepatitis virus. The first test, the antibody test, tests for the presence of antibodies created by the body when exposed to the infection. These aren't entirely accurate, as sometimes there can be a false result when a body has been exposed but cured itself, leaving the antibodies still present in the blood. The second test, the polymerase chain reaction test, tests for the genetic material of the virions in the blood. These are a little bit more accurate and generally only performed when the individual has a positive antibody test. Further diagnosis would include a biopsy of the liver to see the extent of damage which has been done, as well as a fibrillary test or an ultrasound. Classic treatment of the virus includes antivirals administered at the beginning of a new diagnosis, with the addition of newer direct-acting antivirals. Research into these new medications have proved to be very effective, some even 99% effective in the most recent clinical trials. Vitamin 6 has also been shown with promising results when used in vitro cases.
Hepatitis C is caused by an enveloped single-stranded positive sense RNA virus. It is about 9,600 nucleotide bases long and has a single open reading frame that encodes for about 3,000 amino acids. The genome of HCV, hepatitis C virus, is separated into 5' non-translated regions. structural proteins, non-structural proteins, and 3' non-translated regions. The 5' NTR, non-translated region, function as an internal ribosome entry site. The structural proteins include the core, which is an icosahedral protein which binds inside the membrane that binds to the viral genome to form the nucleocapsids. It also includes the envelope glycoproteins E1 and E2, and these bind to liver cells. The non-structural proteins range from NS1 to NS5B, and these function as transmembrane proteins, RNA helicase, protease, cofactors, interferon-resisting proteins, as well as RNA-dependent RNA polymerase. And these are the structures of hepatitis C virus.